Hi everyone, my name is Ira Solana, your second year student nurse from Surigao Education Center. And today, I am going to perform the Leopold's Maneuver. The Leopold's Maneuver are a common and systematic way to determine the position of a fetus inside the woman's uterus. First things first is to perform a hand washing to prevent the spread of microorganisms. Then greet the client politely, introduce yourself, verify the client using the two identifiers, and ask how the client and how she would like to be called during the assessment. And don't forget to establish a good report so that the client won't feel uncomfortable. Then now, explain the procedure to the client and give the client the opportunity to ask or raise for her concerns. This procedure can be performed with full bladder, so let the patient empty her bladder first before the procedure because emptying your bladder promotes comfort and of course it allows a productive palpation because fetal contour will not be obscured by extended bladder. Hello mom, my name is Ira Solana. You're attending nurse for today. First, may I know your name? Okay. When is your birthday? Okay. Is it okay that I'm going to check for your wristband? Okay. By the way, mom, the procedure that I will be doing is that I am going to perform the Leopold's maneuver to you to determine the position and light of your baby inside your tummy. I am going to touch some parts of your body. Is it okay with you? Okay. So, do you have any clarifications or concerns? Okay then. Okay, so let's empty your bladder first, mom. As you can see, mom, the curtains are closed because there will be other people who can see us, and of course, I will assure you that this won't hurt you and your baby, so don't worry. Before the procedure of the assessment, do you feel any pain or are you uncomfortable? Okay, so let's start. The first thing to do is to place the patient in supine position with knees slightly flexed. This is done for us to facilitate the accurate assessment, then giving comfort and with a slightly flexed knees can relieve the tension of abdominal musculature. If you are a right-handed, stand at the patient's right and slightly lift her shirt and expose the specific area only. Do not forget to ask permission to do it. Mom, I am going to expose your abdominal. Is that okay with you? Okay. Now let's do the first maneuver. Face the patient and palpate the uterine fundus to determine what part of the fetus lies in the upper part of the uterus. This is to determine if the baby's head feels hard, round, freely movable, and ballotable, and of course, if the nodular is softer. For the second maneuver, popping in the downward direction on the side of the abdomen by applying a gentle but deep pressure for us to determine the position of the fetal extremities, fetal back, and anterior shoulder. Of course, this is to determine if the fetal back is in a continuous structure and the side of extremities feel nodular and reflects the portion of the fetal. So now for the third maneuver, place one hand into a centritis pubis and grasp the lower uterine at the segment between the thumb and the fingers feels the presenting part. This is for us to determine if the engagement thus occurred and of course if the fetus feels in the pelvis, also if the head in the pelvis is in 0% part and still movable, this means this is not yet engaged. So the fourth maneuver turns and face the patient feet to confirm the findings into the third maneuver and determine the vision of the fingers into the pelvis. This is for us to know if the prominence is felt on the side where there is a greater resistance to the descent of the vertex. Then locate the back of the fetus, then place the stethoscope over it and listen for the fetal heart tone in 1 full minute. And for us to know if the baby's heart is normal, we should hear a 120 to 116 beats per minute. So note for the location, rate, character of the fetal heart tone for documentation and records afterwards. Make sure that the patient is comfortable and document the observation made. The fetal findings and presentation, position, attitude, and whether the engagement or the floating to promote the database for the future. And after finishing the procedure, do not forget to wash our hands. Today, I examined Blue, a 23 years old at 21 weeks and 3 days with her first pregnancy. So upon the palpating, it was soft and non-tender. The baby's head feels hard, freely movable, and the structures felt at the side of the fetal back, so the extremities feel the nodular, and it reflects the portion of the fetal. The presenting part is still movable, which means it is not yet engaged. This symphonic prominence is felt in the side where there is a greater resistance of the descent of the vertex, and the vital heart tone is 120 beats per minute.